Hi, I'm Dr. Tracie Leonhardt, and I have a clinic called the Peaks of Health Metabolic Medical Center located in Clearwater, Florida. I went to medical school at Southeastern University, which is now Nova, in Florida. I was trained in Chicago in emergency medicine, practiced emergency medicine for about 14 years, became the medical director of Northside Hospital Emergency Room, and then I had my daughter. It wasn't exactly conducive to practicing and being a medical director. And on top of that, I gained a ton of weight. And I became diabetic and everything else. So I met up with my partner and lost all the weight through the medical practice of bariatrics. And from there, I got into treating weight loss and type 2 diabetes. I turned around and started looking at hormone therapy. And the problem I found was I couldn't find that many doctors locally that really knew how to do hormone replacement therapy really well. I could go to Tampa, I could go to Orlando, I could go to Bradenton, but I really couldn't go very locally. So I took a weekend course, so to speak, and realized how complicated it was. So from there, I started doing the fellowship in A4M, and it snowballed. I've gotten so far into treating GI health and the biochemistry of the body, really getting into functional medicine. Love it because it really has shown me where to find where the problem is. Going after the problem of why somebody's sick instead of just, okay, let's treat it this way. Digging deep into why somebody becomes diabetic, why somebody gets chronic fatigue syndrome, what are all the different aspects that fall into that, or they have toxicities in their body, why their thyroid isn't working instead of just throw thyroid medication at them. Thyroid is unbelievably important, and one thing I found is that a lot of patients who think that they're hypothyroid are told by their doctors that their thyroids are fine, and that there's a lot of different aspects of thyroid. It is a gland that is very sensitive to a lot of damage. Viral infections, it's sensitive to not converting correctly. So when I actually look at thyroid, I found that a lot of patients not only have antibodies to their thyroid, but they're not converting their thyroid correctly. So they're very symptomatic. They keep on telling their doctors they think they have hypothyroidism, and the doctors are telling them they're fine. And then we start actually looking at the function of the thyroid and finding that they really do have hypothyroidism, start treating them and treating the symptoms that they have and trying to find out why their thyroid's not working correctly. And all of a sudden they start feeling much better. And the thyroid's so important. It's not just about weight. It is really about every cell in the body is slowing down when the thyroid slows down. So your memory slows down, your body's not heating up correctly, your immune system, gets slowed down, your GI tract slows down. So it's really important to, be able to evaluate that correctly and treat it correctly. In traditional medicine, we just ran basic metabolic profiles and CBCs, and it gives you very little information as to what's really going on in the body, You would get these tests back and you say, oh, everything looks fine, or the thyroid looks okay with a TSH. But when you start really digging in deeper into some labs, LabCorp will do some of the testing. But if you're looking at amino acids and organic acids and all the breakdown products of what the body does to find out where some deficiencies are occurring, you really need to go to specialty labs. If you're trying to find out what's really going on in the GI tract, if they have yeast overgrowth or parasites, the normal, typical white blood cells in the stool or things really don't show any of that. You can actually see exactly how their body is breaking down their food if you do specialized testing in that and see exactly what's going on in that GI tract to try to fix it. It gives you a lot more information to turn around and start really targeting where some of the problems might be occurring. It's kind of like CSI of the body, and it's really interesting, and I love it. If you want more information or contact information, you can go to our website at thepeaksofhealth.com.
A4M's Longevity Magazine e-journal is your weekly online e-newsletter featuring great articles on wellness, prevention, and biotech advances in longevity. To get A4M's e-journal free of charge, go to the A4M website, worldhealth.net, and sign up on the homepage. It's free.